Lupus is really complicated. It's a disease of the immune system. And the immune system's evolved to protect us against invaders, against bacteria. And in lupus, the immune system fights the host, it fights the self, it gets confused. And as a consequence of the immune system fighting your own tissues, you have organ damage and you get sick. In the past, women with lupus were told, don't get pregnant. Your disease will flare up, you could die, your baby could die. It would potentially be disastrous. And what we've done is we've studied 331 patients in many centers throughout the United States and asked the question, how do lupus patients do in pregnancy? And what we've learned is they can have perfectly normal, healthy, successful pregnancies. The key is timing. In terms of when to get pregnant, patients who are not flaring at the time they conceive and are well at the time they conceive, 4 out of 5 of them are likely to have a successful pregnancy. Patients generally know how their disease is doing. When lupus patients flare, they have arthritis, they have rashes, they have fevers, they feel sick. It's very important for the patient with lupus to have a discussion with their doctor and talk about contemplating pregnancy. And in that discussion, it'll become clear that if your disease is not flaring and you're doing well, it's a good time to get pregnant. I think this is hopeful and important. I'm grateful that so many investigators throughout the United States collaborated with me and that the NIH funded the study and that the Hospital for Special Surgery was a place that was the home of the study. And I think it's great news for patients.